This is trapezius muscle. This is originated from medial one-third of superior nasal line and external occipital protuberance and ligamental notch and C7 spine and T1 to T12 spine. This is insert upper fibers are inserted into the lateral part of posterior one-third of posterior border of the clavicle, and medial fibers are inserted into medial margin of acromion, and lower fibers are inserted into the superior margin of spine of scapula. The nerve supply to the trapezius muscles are spinal accessory nerves and C3 C4 spinal nerves. Action are upper fibers are helps to the elevation of scapula. Middle fibers are helps to the retraction of scapula. Lower fibers are helps to the depression of scapula, and upper and lower fibers are both are combined helps to the abduction of scapula.
The deltoid muscle, the anterior fibers of deltoid muscles are take origin from lateral one-third of clavicle in the anterior borders, and the middle fibers are that are also called acromion parts that are taking origin from the lateral border of acromion process, and the posterior fibers are taking origin from the lower lip of the crest of spine of scapula, and it was attached to the deltoid tuberosity of humerus, which is insertion, and it is nerve supply by axillary nerves, and action is upper anterior fibers are doing medial rotation and flexion, middle fibers are helping in abduction of 90 degree, and posterior fibers are helping in the extension and lateral rotation of arm.
This is the latissimus dorsi. This is originated from posterior border one-third of the outer lip of iliac crest and posterior layer of lumbar fascia, and this is originated from the inferior angle of scapula and T7 to T12 of spine. This is inserted into the floor of intertubercular sulcus of humerus, and the nerve supplies are thoracodorsal nerves, and actions are adduction, extension and medial rotation.
The levator scapulae muscle that takes the origin from the transfer process of C1 and C4 vertebrae, and the insertion is medial border of scapula between superior angle and the root of spine. The nerve supply is to dorsal scapular nerve and C3 and C4 spinal nerves, and the action is elevation and medial rotation of scapula and tilts its glenoid cavity inferior. The muscle rhomboides minor. It takes origin from lower part of ligamental notch and spine of C7 to and T1 vertebrae. The insertion is base of triangle area at the root of spine of scapula, and the nerve supplies dorsal scapular nerve from C5. The action is retraction and elevation of scapula. Muscle rhomboides major. It takes origin from spine of T2 to T5 vertebrae, and it was inserted in the medial border of scapula from the root of spine to inferior angle. The nerve supplies dorsal scapular nerve, and the action is retraction and the medial rotation and elevation of the scapula. Muscle supraspinatus. It takes origin from medial two-thirds of the supraspinous fossa of scapula, and it was inserted to the superior facet of greater tubercle of humerus, and the nerve supplies suprascapular nerve from C5 and C6 vertebrae, and the action is initiate the adduction of the arm and carries it up to infraspinatus. It takes origin from the upper medial two-thirds of infraspinous fossa of scapula, and it was inserted to medial facet of greater tubercle of humerus, and the nerve supplies suprascapular nerve from C5 and C6 as the supraspinatus, and the action is lateral rotation of arm. Teres minor takes origin from upper two-thirds of dorsal aspect of lateral border of scapula, and it was inserted to the inferior facet of greater tubercle of humerus, and the nerve supply is axillary nerve from C5 and C6 vertebral spine, and the action is lateral rotation of arm. Teres major, muscle teres major takes origin from inferior one-third of dorsal aspect of lateral border of inferior angle of scapula, and then inserted to the medial lip of intertubercular sulcus of humerus. The nerve supply is lower subscapular nerve from C5 and C6 vertebral spine, and the action is adduction and the medial rotation of arm.